Millions of people across the world have viral hepatitis, and almost 90% of the people don't even know it. In India, hepatitis B second most common cause of cirrhosis, irreversible damage of liver with scarring after alcohol, and the foremost cause of liver cancer. Every year on 28th July, World Hepatitis Day is observed across the world to raise awareness about viral hepatitis. 28th July was chosen to commemorate the birthday of Nobel laureate Dr. Baruch Samuel Blumberg.
Namaskara. My name is Dr. Pramod Kumar. I am a consultant hepatologist and a liver transplant physician at Glen Eagles BGS Hospital. Today we will speak about what is hepatitis and what are the symptoms and how we can prevent hepatitis. And every year we celebrate July 28 as a World Hepatitis Day in memory of Dr. Blumberg because he is the one who who identified hepatitis B virus infection and also the vaccine. Basically, hepatitis refers to the inflammation within the liver, which can, if not treated, which can lead to liver fibrosis and cirrhosis in the long run. Okay, what are the symptoms of hepatitis? We divide hepatitis into acute or chronic, depending on the duration of the symptoms. If a patient comes with a sudden onset of fever, joint pains, and followed by the yellowish discoloration of eyes and urine, then if we do the blood test, then we will know the enzymes, liver enzymes will be in thousands. Then we call it as a acute hepatitis. The most common causes for acute hepatitis include hepatitis A and hepatitis E infection. And these are all viral infections. Again, mainly usually comes through the contaminated food and water. Usually the acute hepatitis because of viral infection is short lasting. It lasts for a few weeks and improves in more than 99% of the patients with supportive medications. And preventive measures again for acute hepatitis include having good food and also the avoid drinking of contaminated water. And we do have vaccine for against hepatitis A infection. Again, all children are vaccinated against hepatitis A infection, but for hepatitis C currently we don't have any vaccine. We do have other causes like drugs and other infections also can cause acute hepatitis, again which is a rare thing. Coming back to the second form of hepatitis, which is called chronic hepatitis. Chronic hepatitis patients usually don't have any symptoms. When they get the blood test done, they will notice increase in the liver enzymes. And usually for common causes for chronic hepatitis include hepatitis B infection or C infection. And other most common cause we are commonly seeing is alcohol intake. And the recent emerging cause include again the non-alcoholic fatty liver disease. Hepatitis B again usually these patients have again chronic hepatitis like condition, and also they are at risk of developing cirrhosis and liver cancer if not treated. We do have effective medications for hepatitis B infection which can control this virus, and in the long term it can also prevent many complications related to the infection. For hepatitis C, we have oral medications which you have to take it for 3 months, which 3 months of therapy, the hepatitis C can be cured now. And coming back to the third most common cause, again alcohol intake. Most of the patients who consume alcohol on daily basis develop fatty liver, and that is the again first stage in the alcoholic liver disease. And if you stop it at that stage, again it is completely reversible. Once patient develops alcohol related cirrhosis and all, again it is not reversible. If you stop alcohol intake, usually within few months even the fatty liver disappears, even the liver enzymes becomes normal. And the recent emerging cause include a non-alcoholic fatty liver disease, wherein usually patients notice little variation in the liver enzymes, and followed by when they get an scan of the abdomen, the fatty liver usually confirmed. For patients with non-alcoholic fatty liver disease, usually we tell them to have good lifestyle modifications. Again, that include weight loss and good control of diabetes and hypertension if they have it, and also to do regular physical activity like jogging or stationary cycling, even swimming, at least for 30 to 40 minutes in a day. And again, to avoid junk foods, processed foods, and have a good amount of vegetables and all. Or we can do a 500 to 1000 kilocalorie deficit in our daily food intake. These are the simple measures where we can reverse our fatty liver disease. And if not treated, even the fatty liver disease can progress into the non-alcoholic steatohepatitis, where there's liver damage, which can lead to increase in the liver stiffness. We call it as liver fibrosis. If untreated, again this stage can progress to cirrhosis, which is again a irreversible stage. We do have medicines for the NASH. Now we have newer medications, but ultimately the lifestyle modification, weight loss, remains the backbone of treating non-alcoholic fatty liver disease. Coming back to prevention, how to prevent hepatitis? As I already mentioned, for acute hepatitis patients, for acute infections, better to have a good food and to drink clean water, and don't take alcohol, and avoid also smoking, and good control of diabetes and hypertension if you have it. And lastly, the vaccination. We have vaccination for hepatitis B and A. Get vaccinated for these two diseases and maintain a healthy lifestyle. Thank you.